My name is Ann Cleveland, and thank you so much for joining us for today's webinar hosted by Texas Association for Home Care and Hospice. Today's webinar is entitled Reading the Tea Leaves, What are the top 10 risks for your home health agency and or hospice that your home health agency or hospice will face in 2023. Today's presenters are Leonard Schneider and Richard Vercoor. Richard Vercoor, JD CMCO Senior Attorney. Mr. Vercoor is a 30-year Texas attorney, a certified medical compliance officer, and frequent speaker. Prior to joining Lyles Parker PLLC in 2012, he had worked on a variety of healthcare matters and cases, including oil field and industrial OSHA safety programs, and asbestos and related lung injuries. Since joining Lyles Parker, he has worked administrative overpayment appeals for a variety of healthcare providers and settled cases from $15,000 in value up to several million dollars. Currently, his practice is focused on healthcare-related administrative appeals, regulatory compliance planning, third-party billing contracts, and oil and gas contracts. He offices in Northeast Houston. Leonard Schneider, JD and partner at Lyles Parker. Mr. Schneider currently serves as city attorney for a number of municipalities in Texas. He has extensive litigation experience from serving as an assistant district attorney for Galveston County, Texas. In his current role, Mr. Schneider deals with a wide range of matters, including contracts, employment, water and mineral rights, elections, economic development, and public health matters. Since joining Lyles Parker, Mr. Schneider has expanded his practice to include a variety of health law-related regulatory matters and cases. Mr. Schneider has twice submitted cases before the Texas Supreme Court and has also authored several law articles and offices in Northeast Houston. And now, without further ado, I present your speakers, Richard and Leonard.
Good morning. This is Richard Vercoor. Thank you very much for the introduction there, Ann. And just want to let you all know that my partner, Leonard, is having a little bit of call-in technical difficulty. He'll be joining us as soon as he can. They're trying to get that straightened out right now.
Can you hear me now?
There he is.
Yes, I'm here.
Leonard's here. We're glad you're here, Leonard. Just as a quick note, I wanted to give y'all, let me first talk about the disclaimer here. Presentation is general educational purposes. It's not legal advice because it's not tailored to your situation. It doesn't take your facts, circumstances into account. So this is just for general knowledge purposes. If you have a legal issue, we strongly recommend that you seek out the advice of a qualified healthcare attorney in your local area. Now, just as kind of background, for those of you who have been to this type of presentation before, you know that it's generally working through the OIG work plan is kind of monotonous and boring in a lot of ways because it just talks about topics here and there. And from that, we try to glean where in the world they're going to try to put their focus this year and what they're going to do. Now, COVID has had a lot to do with that. And there are two recurring, or I should say three recurring and huge problems that continue in the healthcare industry, and several other things are tied into that. But it has to do with COVID-19 and pandemic issues. When you have confined environments like SNFs, skilled nursing facilities, and the problems that creates, you have cybersecurity, you have opioids and fentanyl, and you have laboratories and the testing, which has been again tied back into COVID, along with telehealth issues. So you're going to see those main themes recurring again and again throughout this presentation, and we're going to try to cover it for you as best we can. So what I would like to do is let Leonard take us through the first sections here and talk about a little bit of the background, where we're going, and some of the things that have already come up. So Leonard, if you would, let her rip.
All right, thanks, Richard. I appreciate that. I'm sorry for the delay, and I'll try to move quickly to save time. If we can go to slide number 5. What we're going to do is talk about enforcement actions in 2022 that have occurred or what the federal agencies have focused on. These list of items are triggers that causes various federal agencies to investigate and audit providers. We are providing this list to assist you in your compliance efforts and to identify areas that you need to keep watch on and look at. And so some of the triggers that that cause federal agencies to do their investigations are billing for services not rendered, excessive services provided, the unbundling of services, the upcoding of services, double billing, and all these can be monitored by a service provider and by you with a good compliance program and checkups and follow-up. They also look at kickbacks from government-sponsored programs, spike billing, any identity theft, which is primarily selling beneficiary patient list. Another one that you have control over is billing for medically unnecessary services. You know that this is not intentional, but you do have to use due diligence to make sure your billing is good. False statements, they look at telehealth and telemedicine schemes. And so if you are doing telehealth and telemedicine, you want to make sure that you have good compliance programs for that. They look at addiction treatment centers, DME scheme reemergence, lab frauds, primarily in genetic testing, COVID-19 related schemes just due to the amount of money that was influxed by the government for that, and compounding pharmacies. If we can go ahead and proceed to slide 6.
Hold on for
We're
a
going to
second.
look at
Would, Leonard, could
Yeah,
you hold up for a
go
second?
ahead.
Back up for just a second. What Leonard's
Sure.
talking about here is very important. If you don't pull anything else out of this webinar today, look at this, what I call a hot list, because the whole point of doing this is not just trying to figure out what areas the enforcement agencies are going to look at, but what are their triggers? What are the things that they're looking for? And Leonard went over these and talked to you about why they're important. And it's such a great thing that you're doing here, Leonard, because these items are going to be the things you need to keep an eye out for. And you did mention that to our audience here. That's really, really important. And I want to emphasize what Leonard said, because this is how you stay out of trouble. You want to look for these type of problems as you go through your compliance plan this year and the upcoming year, because this is what's going to set off your audits and your investigations. So the more you can be aware of this stuff, the more you can try to anticipate it, the more you can try to deal with it before it happens. That's what's going to protect your claims and keep you from getting into overpayment and investigation trouble.
Thanks, Richard, and please feel free to jump in at any time. Richard's very good at this. So going on to slide 6, OIG is one of the agencies that we're familiar with that does enforcement actions, but other federal agencies are becoming more involved. They're expanding their investigation efforts into healthcare fraud. They're creating joint task force, and you're going to see that as a recurrent theme through this presentation. And so the FBI has jumped in 2022. They are looking at major medical providers and corporations and companies engaged in significant billing medical fraud schemes. So they're targeting large providers and corporations. Obviously, the FBI always looks at organized crime, but this involves schemes spanning multiple states or jurisdictions. And we'll see an example of a joint task force action that did a large enforcement action in 2022. They also have HCF task force and working group national initiatives to apply force multiplier by using resources at the federal, state, local, and tribal levels. Again, they're talking about joint task force. The FBI is focusing on healthcare fraud outreach to educate public and private sector partners on newest fraud schemes. They're doing a national initiative to combat opioid abuse via controlled substances such as fentanyl. They're also focusing on COVID-19, as Richard said. That's going to be a recurring theme. And primarily, they're focusing on telehealth and telemedicine, physicians, clinics, and labs that have engaged in illegal kickbacks for referrals. So they're looking at illegal kickbacks, and you need to make sure that you follow your compliance and understand what they define as a legal kickback, because many times a provider will do something that is, there's a gray area, and the federal government and the agencies are continually expanding that area of what qualifies as an illegal kickback for referrals. And they are doing a health HCF national response team, which is designed to align investigations with the DOJ's National Rapid Response Strike Force involving major healthcare providers in multi-jurisdictional fraud matters. When I look at all these big words and acronyms, it sounds like there's a war on health providers, and in a way, you could say that the war is on fraud and the misuse of public funds. And the government is continually expanding this, and we'll explore those reasons later. We go to slide 7. We're going to talk about what the Department of Justice has done in 2022 as program initiatives. They have coordinated healthcare fraud strike forces, which are multi-agency teams, federal, state, and local investigators that target high fraud rate areas, including South Florida, Tampa, South Texas, New York, Chicago, Philadelphia, Detroit, New Orleans, Dallas, Houston, San Antonio, and Los Angeles. It seems they're focusing a lot in Texas. But what's interesting is, due to this expansion, there's a chance that everybody at one time may experience an audit, and we'll cover that later on. They also started the Appalachian Regional Prescription Opioid Initiative that involves 6 states and 2 hub areas. These 2 hub areas are Cincinnati and North Kentucky and Nashville, Tennessee. So if you're in those areas, be aware of the enforcement actions by DOJ. They have created and are focusing on an opioid fraud and abuse detection unit, which targets prescription opioids in 12 federal districts. This is a very large program, and 11 FBI field offices located in the cities of Birmingham, Charlotte. You can see the rest of that list. They're also expanding their efforts on sober home initiatives targeting addiction treatment centers in Southern District, Florida, and Central District, California. And they're focusing on healthcare fraud crimes involving drug dealing, kickbacks, bribes, wire fraud, mail fraud, insurance fraud, corruption, and billing for services not rendered. I want to stop and say that you can see that the DOJ has expanded its investigations. But particularly when you start looking at the terms wire fraud, mail fraud, insurance fraud, they're expanding their abilities and methods for them to prosecute for fraud. If they can't get you for kickback and bribes, they're going to look at wire fraud or mail fraud or insurance fraud. So again, we just want to make sure that you're aware of what they're looking at and to make sure that you have a good compliance program in place. Excuse me, if we go on to page 8, Richard has provided a really good graph showing the OIG's work plan and enforcement actions in 2022 and some of the results of their enforcement actions, including July 2022. As an interesting note of how much money the government is pouring into enforcement programs, the HHS had the highest expenditures among all federal agencies, including the Department of Defense. Let me restate that. The HHS budget or expenses exceeds that of the Department of Defense and is at $2.4 trillion, including increased supplemental funding for pandemic responses. Again, it just shows the expansion of the government's efforts into monitoring service providers for fraud and kickbacks and the various topics we've covered. Another key thing we want you to look at on the left-hand side, above the circle, is the OIG budget of $458 million. And out of that $458 $53 million, 79 or 80%, or $358 million, is invested in Medicare and Medicaid oversight. If we shift to the right, the OIG's expected recoveries were over $3 billion. What does this mean? That means the rate of return for every dollar they invested in enforcement action, they recovered $12. Now, this is the OIG, not HHS. When Congress looks at funding these agencies, they look at the return on investment, who has the biggest bang for the buck. And obviously, a 12-to-1 ratio by the OIG is something that Congress is going to look at, and that means there's going to be continued funding and expanded enforcement. And all this is going to increase your chances for being audited while you're in this industry. Not saying that you've done anything wrong, it's just that the expansion is going to increase your chances for being audited. I also want to talk about what happened in 2022. One raid resulted in alleged fraud of $1.2 billion. In this raid, more than $8 million was seized, 36 defendants were charged. There were 13 federal districts involved, so obviously there was a task force that we talked about, and there was 52 administrative actions against medical providers. What's the takeaway from this? Number one, there's going to be expanded funding for enforcement efforts. Number two, your chances are going to be increasing for being audited by either a contractor or HHS. And number three, you need to keep out an eye on the triggers that Richard covered on page 5. And so that's why we're bringing this out for you, just to understand that be diligent and have a good compliance program, because efforts, the expansion of enforcement efforts are continuing and will continue. If we can go to page 9, or slide 9, we're going to talk about the OIG's work plan and enforcement actions in 2022, that the expected recoveries from audits and investigations in 2022 is almost $4 billion. And the first line I want you to look at is the third one down, is that the expected audit recoveries, which are civil actions for fraud or billing areas, is $1.2 billion. And these audits are done by either HHS or civil contractors. And if you drop down to the expected investigative recoveries, that's $2.73 billion. And these are criminal actions, fraud, kickbacks. And just to cover it, a civil action, basically, when you look at the civil actions, which are the audit recoveries, that's going to be administrative law fines, penalties for overpayment of claims that should not have been paid. And then you're going to look at your criminal actions, which your investigative recoveries can be both criminal actions and civil actions. And then the third line that is under investigative recoveries is exclusions. That's your bottom line on the chart. And exclusions is just somebody that's been banned from the federal programs, for participating in federal programs. And that means, as a provider, you are tasked by law to do exclusion screening, and you have to do it once a month. And you do this exclusion screening to make sure that you do not employ anybody that has been banned, or contract with anybody that's been banned from the program. So the takeaway for this is that your documentation is very important. You want to avoid bad habits and exercise due diligence in your compliance programs. You want to focus on exclusion screening. And I do have a story. I represent a local county health district, and they inadvertently contracted with a provider that was on the exclusion list. They missed it the first time around. When they discovered it, we had to determine whether or not they had to self-report. Unfortunately, we didn't, because it was below the monetary threshold. So they had a good program in place. They checked the first month when they contracted with this provider to purchase medical supplies. And in the second month, when they checked again, they noted that the provider was on an exclusion list. So that's the importance of this. And you don't want to be banned from federal programs if you do hire somebody that's on the exclusion list or contract with somebody. If we go to slide 10, let me look at the time here, Richard. I think I'm buffing up fairly quickly to where I need to turn it over to you. The OIG does a work plan, and they look at topics. And what we've determined for 2023 is that the way the OIG picks topics hasn't changed from last year. The unimplemented recommendations, which is recommendations they have for the top 25 recommendations that they from the previous year that they will recommend for 2023. What we've gleaned from this, if you look at the little bubble at the bottom of page 10, is that they're going to be focusing on key oversight of Medicare and Medicaid. And there's 9 areas they're going to be looking at. One is COVID-19 testing and treatment. And again, this is a reoccurring theme. Home health services, cybersecurity, prescription drug costs, eligibility and program integrity, opioids and substance use disorders, telehealth and other health technology. We keep hearing these redundant themes, managed care, value care programs, and improper billings and payments. If we turn to slide 11, the HAS and OIG, when they went to Congress, are looking at 5 areas. And 5 of those areas come out from the 9 we just covered on page 10. So on slide 11, their first priority that they're going to focus on is reducing risk to beneficiaries from substance use disorder. And in 2021, the OIG reported that just over 1 million Medicare beneficiaries had a diagnosis of opioid use disorder, yet that less than 16% of these beneficiaries received medication-assisted treatment drugs. So that's one area that if you are in a service that does for providing opioids to folks, you need to make sure to be aware that the government is looking at this. Priority outcome number 2 is nursing home safety. And this surprised me. They're stating that providers and state agencies did not always report potential incidents of abuse or neglect involving Medicare beneficiaries with developmental disabilities. For example, OIG audits have reported that providers and various state agencies did not report between 58 to 99% of critical incidents. The OIG identified 4 hotspots as a priority for them to look at and investigate, and those hotspots are Florida, Texas, Southern California, and the Midwest. So the enforcement activity on home community settings is going to be as a priority for OIG and HHS. And if you're in Florida, Texas, Southern California, Midwest, you need to be particularly aware of that. Make sure that you're following your compliance programs and using due diligence. Priority outcome number 3 is the COVID-19 response and recovery. In 2020, OIG found that 2 in 5 Medicare beneficiaries in nursing homes were diagnosed with COVID-19 or likely COVID-19, and the overall mortality rate in nursing homes rose 32% during the first year of the pandemic. And they're listing some areas that they want to improve and look at and focus on, and they want homes to develop necessary internal emergency capabilities and to establish collaborative relationships with other community members. And so that's going to be a focus on homes. Priority outcome number 4 on page 12 or slide 12 is to strengthen Medicaid. And this is very important. This directly affects service providers. The OIG is expanding the Medicaid fraud control units. These are joint task force that bring together state and federal law enforcement agencies. The OIG is expanding the current fraud control units to 20, and they're certifying new fraud control units in North Dakota, Puerto Rico, and the U.S. Virgin Islands. The OIG will also focus on reducing the Medicaid improper payments made to MCOs for increasing proper referrals and for beneficiaries concurrently enrolled in multiple states. And finally, if we look at priority number 5, HHS has acknowledged that they have their own internal security issues. They've been hacked by China, and so they're going to be focusing on their cybersecurity protections for system and data. HAS accounts for nearly 23.2% of all federal expenditures, and the size and importance of HHS makes it a prime target for cybersecurity attacks. And just a quick note, I represented a city that was actually hacked by Russian actors. By the time the city discovered the hack, the Russian actors had recovered some files from the city. And what happens in these instances is that the bad actors will try to freeze your systems and hold you hostage to purchase a key that they give you so you can start operating your systems again. Fortunately, the city I represented had caught it early enough and had enough redundancies and backup is that we didn't have to purchase the key. And that was the main component. The second component was they wanted us to pay money for them to promise to us they wouldn't use personal identification that they had captured. And we said, no, we're not going to pay somebody that stole our personal information for a promise not to use it. Why would we believe a criminal in the first place? So we notified all our employees and gave them free credit checks for 2 years and told them what to do. But it's real. It's out there. And as far as major corporations, major providers, they may be a target. I do know there's been over 30 cities in Texas that have been hacked. And with that story, Richard, I'm going to turn it over to you.
Appreciate it, Leonard. Leonard covered a lot of great stuff there in the first half. I just want to mention a couple of things before we go to the next slide, Ann, is that the overall arching theme of this is that where you can go, the resources for figuring out where OIG is going to target the following year has changed. It used to be in the work plan and the compendium. They pretty much stayed the same for the last 2 years. But if you're stumped for what they're going to focus on, you can always follow the money. Go to the budget. That's where you're going to see these priorities that Leonard just talked about, and you're going to see other focus areas. Sometimes it's hard to go through those spreadsheets on the work plan and try to figure out, all the different things they're focusing on, because there's just literally hundreds of reports in it that get done every year. This is one way you can help focus down on what it is. And like we said, those triggers on slide 5, those are the things that all these programs, OIG, DOJ, FBI, are all looking at. So when you're going through your compliance program, when you're building your compliance program, revising it, doing your internal audits, doing your risk analysis, doing all the things you need to be doing on an annual basis, doing your monthly exclusion checks, these are the things you need to be keeping an eye out for. This is how you keep your program integrity for your own agency or practice viable. Let's go to slide 13, Ann. And by the way, Leonard, thank you very much for taking time out of your busy schedule. Leonard represents a number of cities, and he is a litigator, so he is very, very busy, and I appreciate him taking the time to help us out today. Let's look at the work plan overview for a few specific areas. And for each of these, you see that link up at the very top. This is where you go for the work plan updates. These are Excel spreadsheets. You can go through and peruse all the various things for your particular area if you want more information. I'm just going to give you a few examples in these areas. And if you recall that balloon at the bottom of page slide, it was either 9 or 10. those 9 areas. We talked about the top 9 risk areas or top 10 risk areas. This year, it's like top 9, same as last year. But we're going to talk about hospitals first. The 2 midnight rule is still in effect. Most folks are familiar with it. Whether the 2 midnight rule is used to determine whether inpatient claims with short lengths of stay were incorrectly billed as inpatient, should have been billed as outpatient. And that's still in effect. That's still a big item they're looking at in hospitals. Next slide, please. Next slide, please, Ann. Then you see, let's go back to 14. And now you see some of the items I've gleaned from the work plan. And these are just some of the latest that came out. These are actually from last year. You see review of Medicare payments for trauma claims. They looked at provider relief fund balanced billing requirement for out-of-network patients. They've got a toolkit in there. They've got adverse events at hospitals from a couple of perspectives, national incidence, disparities among Medicare patients, and infection control in the wake of COVID-19. Obviously, those are initiatives that started last year. They're going to continue, as you can see from the first 3 or so. They're dated 2023, so those are continuing. Next slide, please. Now that we looked at hospitals, let's take a look at the next area, home health agencies and hospice. This is what I'm sure you're interested in. What I found is there was not a lot that changed, and I couldn't find a whole lot of initiatives that are new that they have based on these. However, they're going to keep doing the same things that they've been doing and focusing on it. Extra focus on telehealth, opioids, and cybersecurity, as we said before. So in October, there was a study for infection control at home health agencies during COVID-19. They've looked at Medicaid health home services for beneficiaries with chronic conditions. And then there was a nationwide review of hospice beneficiary eligibility. You're going to see what we're talking about here overlap with the next area. Telehealth is going to overlap into several areas, including laboratory work, because all this with COVID-19 and the pandemic has been tied together. So it's hard to talk about one separately without talking about the other. So let's go to the next slide and let's talk about the telehealth issues. COVID-19 had a big impact on it. With that, you've got managed care, you've got the risks and safeguards associated with it. OIG put out a handout that talks about this. And in the Pandemic Response Accountability Committee report, which is a subgroup of the OIG, they shared insights about telehealth use in selected programs across 6 federal agencies. You had the Health and Human Services, the Department of Defense, OPM, the VA, Veterans Administration, Department of Labor, and Department of Justice. And what they found is there's just been an explosion in telehealth since everybody had to go to it in the wake of COVID-19. 37 million individuals used telehealth this past year on selected programs during the pandemic, 13 times the number that was going on before. And over $6 billion was paid out in these programs for telehealth services. Well, with that type of money, obviously, you've got a lot of risk of fraudulent claims being filed, a lot of schemes going on. Anytime there's something new, that's going to happen. So they determined a few billing risks that are particularly viable in the telehealth arena. So that included duplicated claims, upcoding claims, and high volume billing. When you see this, this is an indicator or an area where for telehealth services, there could be problems. So they're going to be eyeballing that. Recommended safeguards. So what are they going to do to help address this? They're going to put additional monitoring of telehealth services. That means additional audits, develop additional billing controls. So you may see more regulations coming down on how these things get filed. Educate providers, individuals. So if you have claims filed, they get rejected. If you have an audit, the provider education that they offer is going to be of increased value. They're going to be collecting additional data and monitoring the impact on quality of care. Next slide, please. And again, here's the link to the spreadsheet work plan updates at the top. I'm going to have this for every section, so if you don't see it the first time, you'll see it on a couple more times before this is over. But it's easy to find. It's oighhs.gov, and you go to the reports tab. There's been a face-to-face patient history issue that they were worried about, but they found something really interesting. When they first started the telehealth expansion, they were worried about folks not getting the patient history since they'd never talked to these patients before, examined them. What they found is that 84% of the Medicare beneficiaries that got telehealth services went to somebody they knew. They didn't really expect that. They didn't go to new ones. So it was much less of a problem than they thought it would be. On the other hand, electronic health records, they found that out of necessity, they were going to have to do something to improve the system, make sharing those records easier while still trying to control the risk of exposing that to unauthorized access. So the way they do that is with technology. So the areas they're going to be looking at to help tighten that up, use and effectiveness of technology to drive value for patients and programs, reducing privacy and cybersecurity vulnerabilities, promoting ethical compliance related to the health technology, and enhancing a data-driven healthcare system that supports the right data to the right person at the right time, including in emergencies, because that's where the current weakness is. And this is taken, again, sometimes you have to look for outside sources during the way the work plan has evolved, because the traditional sources where this information used to be in a nice tight little presentation and an executive summary, and you could pull it up and have a general idea of where they were going. Now you got to kind of go all over the map, different sources, to figure out what in the world are these guys going to be doing next year. This fortunately came from a keynote speech given by Christy Grimm, Inspector General, at the HCCA conference back in March of 22. So this is the most recent information I could find, and we're going to be pulling a little bit more from that keynote speech because she talks about where the focus needs to be. Next slide, please. Here's 3 items that came from the spreadsheet that talk about telehealth issues, Medicare telehealth services during COVID-19, the risks that they found, services in selecting federal healthcare programs, and behavioral health services and managed care. Next slide, please. Skilled nursing, SNFs and nursing homes. This is a big area, continues to be a big area, and according to the Inspector General, they wanted to focus on this because they found that the number of deaths had increased significantly during the pandemic due to sheltering in place. And as a result, they also found that the impact was different on Black, Hispanic, and Asian residents. They had a higher incidence of COVID-19 mortality, and they're trying to figure out, you know, whether that was hereditary, whether it was genetic, whether it was aggravated by certain circumstances, procedures, supply problems, or other issues during the pandemic. And that's something else we're going to talk about here in a minute, working cooperatively to try to improve your situation in a nursing home. Let's go to the next slide. Again, here's some of the topics. The Senior Medicare Patrol projects. They did a study on that. Audit of Medicaid nursing facility use of funds for direct patient care. Medicaid nursing home life safety issues, which is a big one. And then nursing home reporting COVID-19 data. Next slide, please. The sober homes, the opioid and substance use disorders and things like primarily back to fentanyl. In a recent study, they only found 16% of Medicare beneficiaries with an opioid use disorder received medication treatment. So they're looking to expand that medication program, the MAT program. And this was again from the keynote speech. And here below that, you can see some of the topics, recent topics from the work plan that accentuate this focus. Access to medications for this type of problem, inpatient rehab facility audit nationwide, and opioid use in Medicare Part D. Next slide, please. And then we have laboratories. It's strange, I found no new laboratory initiatives for the second half of 2022, but several initiatives were continued. The COVID scams, this is interesting. A COVID-19 related scam have continued to be prevalent since April 2020. The scams include set up fake testing sites and parking lots just to steal folks' ID numbers and Social Security, or charging patients for fake treatments, falsified vaccine cards, a provider billing over $100 million to a COVID-19 program for surgeries and services that never happened, was one other scam that occurred. And
I'm sorry, everyone. Just give us one moment. It seems we're having some technical difficulties. Let me see. Give us one moment, okay? Thank you so much. Are you there? Hi, Leonard. Are you still there?
Yes, I am.
Are you on the call? Okay. Could you possibly keep going for Richard in the time being? I think we're going to try and see if we can get him back on the line. Is that okay with you?
Sure. Let's go to slide 23.
All righty. Give me one moment. I'm going to get.
All righty. Thank you. I'm just going to quickly say, I believe Richard Cutout, he was talking about the scheme where they were setting up parking lot, COVID testing facilities to steal people's personal information. They also found that there was laboratories that were billing Medicare for expensive, unnecessary, and sometimes unprovided genetic tests. On average, these tests cost around $1,500, and the alleged fraud and takedown is noted $1.4 billion and may be higher. And Medicare suspended payments for 26 laboratories. And what this means is that the COVID-19 testing and laboratories are going to be scrutinized with all these various task force and the OIG and DOJ. Going on to 23, we are talking about the unimplemented recommendations for 2023. These are the same as they were for 2022. We'll cover these quickly, and hopefully Richard can get back on. They're going to focus on protecting patients. CMS is going to make sure that nursing homes are implementing actions to prevent the spread of COVID-19 and to protecting the residents. So that's going to be a focused effort, and so these type of providers need to make sure that they're aware of this and that they are implementing recommended actions. CMS should also take actions to ensure that incidents of potential abuse or neglect of beneficiaries are identified and reported. We talked about that earlier, that one of the 5 areas that OIG is going to be focusing on was the under-reporting of potential abuse of individuals. They said sometimes up between 60 and 99%, if I remember correctly.
Leonard, I'm back.
Okay, we're on slide 23, Medicare Parts A and B.
Okay, which one did you just cover?
I just covered the first 2 of the top 25 unimplemented.
Okay. Well, I apologize to everybody. My internet went down. I don't know what happened, but basically the top 25 unimplemented recommendations are the same as they were last year. The last published compendium was from 2021. You can go out to the OIG website and find it if you want to. I don't want to make light of these, but I think we need to move on and talk about a couple more things that are a little more important. These will be incorporated, same as they were last year. So let's go to the next slide here. And let's go on page past the unimplemented recommendations. You can see them there and you can read them. We'll do that later. Let's catch up a little bit here. Okay. So let's talk about reducing your risk of audit. What can you do to help reduce your risk and avoid audits? Prepare, get a compliance plan, put it in place, do your internal audits, do all that work. But like I said, the work plan, these items are out there to be found. Go to the budget, go to the work plan, go to the compendium, and you can do for yourself what we're doing for you here, or you can tune in each year. You need to understand the Affordable Care Act's federal requirements say that everybody has to have a compliance program. If you're not doing it, you are way behind. This has been in place for a few years now, so you need to get it done. Federal compliance plan requirements are being enforced. It's your single best defense to risk overpayments, penalties, fines, etc. You have to get proactive about this. And remember your state requirements. For instance, if you participate in Texas Medicaid, you've already certified to the state that you have an active and effective compliance plan in place. You've sworn to that. And if you haven't done so, you better get it done, because otherwise you just lied to the state, and that's not good. Let's go to the next slide. Okay, remember that the last year AKS and Stark had some revisions. There's a new exception for telehealth under beneficiary inducements, civil monetary penalties, and that is for in-home dialysis, and you can read it there, amendment to the definition of remuneration, civil monetary penalties, assessments, and exclusions. And there's the link for the general fact sheet in the final rule on the anti-kickback statute, along with the link for the Stark self-referral regulations. Those are your links for the changes. Next slide, please. Supreme Court update. I wanted Leonard to chime in on this. The elephant in the room, of course, is Roe versus Wade. We don't have time to talk about everything, but the bottom line of this is that the federal government has decided to step back and out of that arena, turn that decision back over to the states, because there is such a difference in the different types of states, their focus, their needs. It's all wildly different from one state to another. Arizona is going to be very, very different from Maine or Florida or California or Oklahoma. So that's the bottom line of what that said. Now, Texas has put the halt to that enforcement in Texas because of a judge in Lubbock, federal U.S. district judge up there, put an injunction on it. But as far as nationally, this is going to take a while to shake out. Leonard, you give your thoughts?
Well, basically, what the Supreme Court did, they did not outlaw the provision of abortion. They just made it from a federal mandate. They returned it back to the individual states as it existed prior to Roe versus Wade. So everybody's going to have to be familiar with their state laws and what your state legislature is doing regarding the provisions of these type of services. So once again, it just depends by state and their guidelines. Texas has stepped in and complained about what they consider as federal overreach, and the judge did, as Richard explained, suspend that. But beyond this, the takeaway is be familiar with your state laws and state legislatures and what they're doing on this topic.
This is going to come with problems. The Texas Medical Association said for a while, some hospitals in Texas in July refused to treat patients with major pregnancy problems because they were in fear of violating the state's abortion ban. So fortunately, the injunction here in Texas eliminated that problem for our state for now. But, you know, this whole thing is a minefield fraught with problems, and it could take a decade or more to shake out all over the country. And no one's really going to know what the law is on abortion from state to state until more time goes by, frankly. Next slide, please. And this is just a reminder. These are from last year that the revocation regulations have expanded. You can see 3, 4, 5, 6, 8 new reasons down there at the bottom. They've gone from 12 to 21. It just means that they've got more flexibility as far as deciding when they can revoke your participation in the program. And the next slide. Same thing for enrollment and re-enrollment denials. Those have been expanded. There's more permissive reasons. And it just means that's even more reason to keep your compliance programs in line. And I think that's the end of our presentation. Do we have any questions, Ann?
I don't see any questions for you guys currently. Most are wondering where you went, Richard. Most people. But anyways, you know, if there's no questions, that concludes today's webinar. Thank you so much for joining us, you guys, and thanks for staying with us through our brief technical issue. And thank you so much to our speakers, Richard and Leonard. And everyone from today's webinar will receive copies of the presentation slides via email. If you have any questions about today's discussion, or another healthcare law-related issue, please feel free to reach out to Lyles Parker. Thank you so much, everyone.
Thank you.
Thank you.